What organ of the lymphatic system is the site of T-cell maturation? A. The thymus. B. The spleen. C. The cisterna chyli. D. The lymph nodes. The answer is A. The thymus. T-cell maturation occurs in the thymus, a small organ located in the upper part of the mediastinum, between the heart and the sternum. Mature T cells then may either circulate in the lymph or blood or reside in lymph nodes. The spleen is not a site of T-cell maturation, though it does have other important immune functions, such as the production of antibodies and the removal of antibody-coated pathogens. The cisterna chyli is a part of the lymphatic system that is involved in lipodigestion. Digestive fat is absorbed through what specialized lymphatic vessels of the small intestine? A. Villi. B. The cisterna chyli. C. Lacteals. D. Microvilli. The answer is C. Lacteals. Dietary fat is absorbed via lacteals, small lymph vessels contained within the body of the intestinal villi. Microvilli, tiny projections covering the surface of the villi, help with the absorption of minerals, vitamins, and other micronutrients. The cisterna chyli is a dilated pouch at the lower end of the thoracic duct that serves as a collection point for fatty chyle from the intestinal lacteals. Which of the following is not a function of the lymphatic system? A. Absorption and transportation of dietary fats. B. Lymphocyte transport and activation. C. Secondary gas exchange. D. Draining of interstitial fluid from tissues. The answer is C. Secondary gas exchange. The lymphatic system has several roles in the body, including drainage of interstitial fluid from tissues, transportation and activation of lymphocytes, and absorption and transportation of dietary fats. Red blood cells, however, are unable to enter lymph vessels, and so the lymphatic system does not participate in any type of gas exchange. When drawing blood, the client tells the nurse that she is a universal recipient. The nurse knows this to mean that the patient has which type of blood? A. O negative. B. AB negative. C. A positive. D. AB positive. The answer is D. AB positive. AB positive is a universal recipient, meaning a patient with AB positive type blood can receive a blood transfusion using any type of blood. Every Hem group in hemoglobin encloses an atom of what element? A. Magnesium. B. Chromium. C. Copper. D. Iron. The answer is D. Iron. Each Hem group in hemoglobin encloses a single iron atom in the center of a protoporphyrin, a tetrapyrulyl composed of 4 pyrulyl rings linked together by 4 methyl groups, 2 vinyl groups, a methane bridge, and 2 propanoic acid side chains. What is the average lifespan of an erythrocyte? A. 4 months. B. 6 weeks. C. 6 months. D. 3 months. The answer is A. 4 months. The average lifespan of a red blood cell is 4 months, after which it is phagocytosed by macrophages, the spleen, liver, or lymph nodes. White blood cells, on the other hand, live for only about 3-4 days. What hormone stimulates the casting of new red blood cells? A. Luteinizing hormone. B. Vasopressin. C. Erythropoietin. D. Thyroxine. The answer is C. Erythropoietin. The casting of new red blood cells is stimulated by the hormone erythropoietin, EPO, released from the kidneys. Recall that all blood cells are made in the bone marrow. This hormone may increase as much as 1,000-fold in times of oxidative stress. Thyroxine is T4, the most biologically active form of thyroid hormone. Vasopressin, or antidiuretic hormone, is part of the body's fluid balance system. Luteinizing hormone is a hormone of the reproductive tract. In females it triggers ovulation, while in males it stimulates Leydig cells to produce testosterone. Where is erythropoietin produced? A. Peritubular interstitial cells of the kidney. B. Lactotroph cells in the pituitary gland. C. Zona fasciculata cells of the adrenal glands. D. Supraoptic and paraventricular cells of the hypothalamus. The answer is A. Peritubular interstitial cells of the kidney. Erythropoietin is produced by the peritubular interstitial cells of the kidney. These cells are very sensitive to tissue oxygen pressure. When oxygen demand increases, erythropoietin is released, stimulating the casting, hematopoiesis, of new red blood cells in bone marrow. Supraoptic and paraventricular cells of the hypothalamus are the site of vasopressin, antidiuretic hormone, production. Lactotroph cells in the pituitary gland are responsible for the production of prolactin. Zona fasciculata cells of the adrenal glands produce cortisol. Neutrophils make up what percent of white blood cells in the blood? A. 20 to 35%. B. 55 to 70%. C. 70 to 90%. D. 2 to 6%. The answer is B. 55 to 70%. Neutrophils are the most common type of white blood cell, making up 55 to 70% of the total white blood cell population in the average blood sample. Eosinophils make up what percent of the average white blood cell count? A. 5 to 15%. B. 1 to 3%. C. Less than 1%. D. 20 to 40%. The answer is B. 1 to 3%. Eosinophils are the leukocytes that are largely responsible for response to parasitic infections and allergies. They make up 1 to 3% of the average white blood cell count. They form the second smallest population of white blood cells, after basophils, which normally make up less than 1% of white blood cells in whole blood. Monocytes make up what percent of the average white blood cell count? A. Less than 1%. B. 2 to 10%. C. 26 to 33%. D. 55 to 70%. The answer is B. 2 to 10%. Monocytes, the largest of all the leukocytes, make up just 2 to 10% of the average white blood cell count. These white blood cells will mature into macrophages to phagocytose foreign matter. Monocytes make up what percent of the average white blood cell count? A. Less than 1%. B. 2 to 10%. C. 26 to 33%. D. 55 to 70%. The answer is B. 2 to 10%. Monocytes, the largest of all the leukocytes, make up just 2 to 10% of the average white blood cell count. These white blood cells will mature into macrophages to phagocytose foreign matter. What is the role of platelets in the blood? A. Gas exchange. B. Cytotoxicity. C. Clotting. D. Histamine release. The answer is C. Clotting. Platelets are small cell fragments that play an important role in hemostasis, or clot formation. Once activated, platelets release clotting factors that recruit more platelets till a clot is formed and bleeding stops. The process by which white blood cells move into and out of blood vessels is dash. A. Phagocytosis. B. Dipodesis. C. Granulocytosis. D. Endocytosis. The answer is B. Dipodesis. Dipodesis, also known as leukocyte extravasation, is the process by which white blood cells move into and out of blood vessels. This process includes 4 stages: chemotraction, rolling adhesion, tight adhesion, and endothelial transmigration. This process is integral in the delivery of white blood cells to sites of infection and in their return into the bloodstream to mobilize and facilitate the excretion of waste. All of the following white blood cells are granulocytes except dash. A. Monocytes. B. Basophils. C. Neutrophils. D. Eosinophils. The answer is A. Monocytes. Neutrophils, eosinophils, and basophils are all granulocytes, meaning they contain visible granules within their cytoplasms. These granules contain acids and antimicrobial enzymes, and are released at the site of infection. Monocytes and lymphocytes are granulocytes, meaning they do not contain granules in their cytoplasm but rather destroy foreign proteins by other means, such as phagocytosis and cytotoxicity. Platelets are derived from what parent cell? A. Plasma cells. B. Megakaryocytes. C. Erythrocytes. D. Progranulocytes. The answer is B. Megakaryocytes. Platelets are derived from megakaryocytes, cells produced in bone marrow, kidney, liver, and spleen, with large, lobed nuclei. Platelets are formed within the cell and then released into plasma. Erythrocytes, mature red blood cells, plasma cells, a type of B cell, and progranulocytes, precursors to neutrophils, basophils, and eosinophils, take no part in the creation of platelets, which are fragments of cells, not whole cells. What is the average amount of blood in the adult body? A. 3.5 to 5.5 liters. B. 6 to 7.5 liters. C. 4.5 to 6 liters. D. 7.5 to 9 liters. The answer is C. 4.5 to 6 liters. The average adult body contains 4.5 to 6 liters of blood, depending on size and gender. Blood volume, BV, can be calculated by the following formula, given the hematocrit, HC, and plasma volume, PV. BV equals PV divided by 1 minus HC. The most common free plasma proteins include all of the following except A. Globulin. B. Major histocompatibility complex, MHC. C. Albumin. D. Fibrinogen. The answer is B. Major histocompatibility complex, MHC. The three main types of proteins in the blood are albumin, globulin, and fibrinogen. Major histocompatibility complex is not a free plasma protein, but rather a class of proteins found on the surface of all nucleated cells, MHC class I, and on the surface of certain immune cells known as antigen-presenting cells, MHC class II. They play an important part in immune function by displaying foreign antigens for communication between leukocytes. Lymphocytes, natural killer cells, T helper cells, and B cells, make up what percentage of white blood cells? A. 55 to 70%. B. 1 to 3%. C. 26 to 33%. D. 5 to 15%. The answer is C. 26 to 33%. Lymphocytes are the second most common class of white blood cells, making up 26 to 33% of white blood cells. Which of the following blood cells is anucleate, lacking a nucleus? A. Natural killer cells. B. Dendritic cells. C. Megakaryocytes. D. Erythrocytes. The answer is D. Erythrocytes. The only anucleate blood cells are erythrocytes, or red blood cells. These cells are created with nuclei, but each daughter cell will then lose its nucleus in order to create more surface area for hemoglobin to bind oxygen and for easier passage through narrow capillaries. The nurse cares for a patient hospitalized for 5 days with pneumonia. He is about to be discharged and the nurse is providing discharge instructions to the patient and the family. Which statement made by the patient's family should most concern the nurse? A. He can stop taking the antibiotics when the symptoms are gone. B. He still has to use the incentive spirometer to keep his airways clear and open. C. He can eat normally but we have to make sure he has a nutritious diet. D. He can start doing his chores when he feels better, but shouldn't overexert himself and should rest a lot. E. He should stay away from other sick people because his immune system is still weak. The answer is A. He can stop taking the antibiotics when the symptoms are gone. When a patient has an infection and is prescribed antibiotics, the patient should always take the full course of the medication and never discontinue the medication. It is easy for patients to believe they can stop taking the medication when the symptoms are resolved, but the nurse needs to educate the patient to continue the full regimen. The rest of the statements are accurate. The patient must get adequate rest, eat well, use the incentive spirometer, and stay away from others who are sick until he is well. A 2 plus radial pulse is considered to be dash. A. A normal pulse. B. A bounding pulse. C. An absent pulse. D. A weak pulse. The answer is A. A normal pulse. The following scale applies to the amplitude of a pulse when palpated at the radial artery. 3 plus is an increased or bounding pulse, 2 plus is a normal pulse, 1 plus is a weak pulse, 0 is an absent pulse. Which of the following locations is most appropriate for assessing the pulse of an infant? A. Carotid artery. B. Brachial artery. C. Radial artery. D. Popliteal artery. The answer is B. Brachial artery. The most appropriate location for assessing the pulse of an infant is the brachial artery, which travels from the axilla down the ventral surface of the upper arm to the cubital fossa. The popliteal and radial pulses are difficult to palpate on an infant due to their size, and the carotid artery can be difficult to palpate due to an infant's shorter, thicker neck. Which of the following is a normal adult respiratory rate? A. 11 breaths per minute. B. 9 breaths per minute. C. 16 breaths per minute. D. 22 breaths per minute. The answer is C. 16 breaths per minute. Normal adult respiratory rate is 12 to 20 breaths per minute. A respiratory rate below 12 is defined as bradypnea, while a respiratory rate above 20 is considered tachypnea. What is a normal respiratory rate for an infant under 1 year of age? A. 30 to 60 breaths per minute. B. 20 to 30 breaths per minute. C. 10 to 20 breaths per minute. D. 60 to 90 breaths per minute. The answer is A. 30 to 60 breaths per minute. Infants have the highest respiratory rate of any age group. A normal infant respiratory rate is 30 to 60 breaths per minute. How might an overlarge cuff affect your blood pressure reading? A. The reading would be artificially low. B. There would be no significant effect. C. The reading may be unstable. D. The reading would be artificially high. The answer is A. The reading would be artificially low. An overlarge blood pressure cuff will often result in a blood pressure reading that is artificially low. It is important that the nurse chooses the appropriate blood pressure cuff size for each individual patient. While assessing a patient's blood pressure, what part of the stethoscope should be placed against the patient's antecubital fossa, the bell, or the diaphragm? A. The diaphragm. B. The diaphragm should be used first, then the bell. C. The bell. D. The bell should be used first, then the diaphragm. The answer is A. The diaphragm. When taking a patient's blood pressure, the diaphragm alone should be used to listen at the antecubital fossa. The bell, used for low-pitched sounds, would not give the examiner accurate enough information to assess systolic or diastolic pressure. Which of the following would be considered a normal adult blood pressure? A. 124/84 mm of mercury. B. 88/56 mm of mercury. C. 110/72 mm of mercury. D. 132/88 mm of mercury. The answer is C. 110/72 millimeters of mercury. Normal adult blood pressure is anywhere from 90 to 120 millimeters of mercury systolic over 60 to 80 millimeters of mercury diastolic. 120 to 140 millimeters of mercury over 80 to 90 millimeters of mercury would be considered prehypertension, while anything over that would be considered either stage I or stage 2 hypertension. What is a normal respiratory rate for a child aged 1 to 6 years old? A. 34 to 44 breaths per minute. B. 12 to 24 breaths per minute. C. 36 to 54 breaths per minute. D. 24 to 34 breaths per minute. The answer is D. 24 to 34 breaths per minute. A normal respiratory rate in a child aged 1 to 6 years is 24 to 34 breaths per minute. This is significantly higher than an adult normal respiratory rate, which is 12 to 20 breaths per minute. What is a normal heart rate for an infant under 1 year old in beats per minute, BPM? A. 160 to 240 BPM. B. 100 to 160 BPM. C. 60 to 100 BPM. D. 30 to 60 BPM. The answer is B. 100 to 160 BPM. Infants have the highest heart rate of any age group. Normal heart rate for an infant under 1 year of age is 100 to 160 BPM. What is a normal heart rate for a school-age child, 6 to 12 years of age, in beats per minute, BPM? A. 100 to 140 BPM. B. 50 to 70 BPM. C. 70 to 120 BPM. D. 120 to 160 BPM. The answer is C. 70 to 120 BPM. Normal heart rate for a child aged 6 to 12 is 70 to 120 BPM. This is moderately higher than normal heart rate for an adult, which is 60 to 100 BPM. What is the correct way to determine proper blood pressure cuff size? A. The inflatable bladder should cover approximately 50% of the circumference of the forearm while its width should cover approximately 20%. B. The inflatable bladder should cover approximately 80% of the circumference of the forearm while its width should cover approximately 40%. C. The inflatable bladder should cover approximately 40% of the circumference of the forearm while its width should cover approximately 80%. D. The vinyl covering should be able to wrap at least twice around the forearm. The answer is B. The inflatable bladder should cover approximately 80% of the circumference of the forearm while its width should cover approximately 40%. Proper cuff size is very important for accurate blood pressure assessment. The correct way to determine proper blood pressure cuff size is to wrap the cuff around the arm, then note the area covered by the inflatable bladder. The inflatable bladder should cover approximately 80% of the circumference of the forearm while its width should cover approximately 40%. A stethoscope has two components to the chest piece. These are called the dash and the dash. A. Cone. Diaphragm. B. Bell. Diaphragm. C. Bell. Disc. D. Cone. Disc. The answer is B. Bell. Diaphragm. The chest piece of the stethoscope is made up of two components designed for auscultation, the bell and the diaphragm. The bell is dome-shaped and used for auscultation of low-pitched sounds, while the diaphragm is used to auscultate high-pitched sounds. A nurse takes a patient's blood pressure and records it at 146/92 millimeters of mercury. This is the patient's first visit to the clinic and they have no past medical records available. Would this patient be diagnosed with hypertension? A. Yes, this is stage I hypertension. B. No, there is not enough information. C. Yes, this is malignant hypertension. D. No, this is within the normal range. The answer is B. No, there is not enough information. A patient with a one-time high blood pressure reading cannot be diagnosed as hypertensive. A diagnosis of hypertension requires at least 3 measurements of blood pressure over 140/90 millimeters of mercury on at least 2 separate visits to healthcare provider. A patient with a blood pressure reading of 168/102 millimeters of mercury on 3 or more occasions would be diagnosed with what stage of hypertension? A. Stage 3 hypertension. B. Stage I hypertension. C. Stage 2 hypertension. D. Pre-hypertension. The answer is C. Stage 2 hypertension. Stage 2 hypertension is defined as a blood pressure equal to or greater than 160 millimeters of mercury systolic over 100 millimeters of mercury diastolic, taken at 3 different times on at least 2 separate occasions. Stage I hypertension is systolic blood pressure of 140 to 160 millimeters of mercury or diastolic blood pressure of 90 to 100 millimeters of mercury, while prehypertension is defined as a systolic blood pressure of 120 to 140 millimeters of mercury or diastolic blood pressure of 80 to 90 millimeters of mercury. Which of the following is not a normal part of taking a patient's vitals? A. Overall visual appearance. B. Pulse. C. Temperature. D. All of these are part of taking a patient's vitals. The answer is D. All of these are part of taking a patient's vitals. While most examiners remember to take the pulse, temperature, and blood pressure while assessing their patient's vitals, overall visual appearance is also an important part of an individual's vitals. Does the patient appear ill? Anxious? Are there any noticeable issues with hygiene or bizarre dress or movements? Are there any signs of pallor, jaundice, or cyanosis? All of these observations can be quickly noted in a patient's chart when taking vitals. The pulse of your patient is 120 beats per minute. What is the appropriate term for this finding? A. Normal heart rate. B. Tachycardia. C. Bradycardia. D. Aortic stenosis. E. Asystole. The answer is B. Tachycardia. Tachycardia is the term used to describe a faster than normal heart rate. A heart rate of more than 100 beats per minute is considered tachycardic. Bradycardia is used to describe a slower than normal heart rate. Less than 60 beats per minute is considered bradycardia. The physician on-call pages you to ask if the patient you are taking care of is febrile. Which of the following vital signs would you find in an febrile patient? A. Blood pressure of 105/89 millimeters of mercury. B. Temperature of 97.9 degrees Fahrenheit. C. Respiratory rate greater than 25 breaths per minute. D. Heart rate of 105 beats per minute. E. Temperature of 103.2 degrees Fahrenheit. The answer is B. Temperature of 97.9 degree Fahrenheit. A febrile is a term used to describe a patient who does not have a fever. Clinically, a fever is defined as a temperature greater than 100.4 degree Fahrenheit. Blood pressure, heart rate, and respiratory rate do not tell you if the patient has a fever. A 39-year-old man presents to the ER with weakness, confusion, and vertigo. His heart rate is 91 and bounding, blood pressure is 132/85 mm of mercury, temperature is 99.0 F, and blood glucose is 49 mg per deciliter. He is non-diabetic, he is not on any medication, and he denies recreational drug use. Which of the following is the most likely cause of his symptoms? A. Hypertension. B. Hypoglycemia. C. Panic attack. D. Infection. The answer is B. Hypoglycemia. The most likely cause of his symptoms is hypoglycemia, which is defined as the blood glucose below 50 mg per deciliter in a non-diabetic patient. The symptoms of hypoglycemia include altered consciousness, tremors, weakness, vertigo, headaches, heart palpitations, and a bounding pulse. A temperature of 99.0 degree Fahrenheit is not considered abnormal as it may reflect a normal variation in body temperature. His blood pressure is slightly elevated, but it is unclear whether this is typical for him or whether this represents a significant change from his normal blood pressure. Regardless, it would not likely be sufficiently elevated to cause his symptoms. It is also possible he may be experiencing a panic attack, but in the presence of his depressed blood sugar, and absence of signs of anxiety, hypoglycemia is the most likely cause of his symptoms. Abdominal rigidity and decreased bowel sounds would raise your suspicions of what condition? A. Cystitis. B. Cholecystitis. C. Peritonitis. D. Ulcerative colitis. The answer is C. Peritonitis. Abdominal rigidity and decreased bowel sounds are classic signs of peritonitis. In addition, the patient will often want to lie very still, as any motion often increases pain. Cystitis, ulcerative colitis, and cholecystitis all may cause significant abdominal tenderness but would not generally result in rigidity or decreased bowel sounds. Why are blind finger sweeps not recommended in infants with foreign objects in their oral cavities or airways? A. They may enter the oral cavity. B. They may force the object in deeper. C. They may trigger a gasping reflex. D. They may trigger a vomiting reflex. The answer is B. They may force the object in deeper. Blind finger sweeps are not recommended in an infant with airway restriction due to a foreign object because they may inadvertently force the object deeper into the airway. A finger sweep should only be used if the object can be visualized. Injury to the oral cavity would not be a primary concern in the case of airway restriction, and a finger sweep would not be expected to trigger either gasping or vomiting in an infant. All of the following are forms of shock except dash. A. Cardiogenic. B. Hypovolemic. C. Anaphylactic. D. All of these are forms of shock. The answer is D. All of these are forms of shock. The four main categories of shock are as follows: cardiogenic, sudden inability of the heart to pump sufficient blood to the body, most commonly due to acute myocardial infarction. Hypovolemic, due to loss of fluids or hemorrhage. Septic, also known as entotoxic shock. Dangerously low blood pressure as the result of systemic inflammatory response to infection. Anaphylactic, systemic inflammatory response to an allergen. What is the normal range for hemoglobin levels in an adult female? A. 12.1 to 15.1 gram per deciliter. B. 4.0 to 9.0 gram per deciliter. C. 14.1 to 21.1 gram per deciliter. D. 8.1 to 13.1 gram per deciliter. The answer is A. 12.1 to 15.1 gram per deciliter. The normal range for hemoglobin in an adult female is 12.1 to 15.1 gram per deciliter. Hemoglobin levels above that range may be indicative of chronic low blood oxygen, while lower levels of hemoglobin are seen in anemia. What is the normal range for hemoglobin levels in an adult male? A. 10.7 to 15.7 gram per deciliter. B. 13.6 to 7.7 gram per deciliter. C. 16.6 to 22.7 gram per deciliter. D. 18.7 to 23.7 gram per deciliter. The answer is B. 13.6 to 17.7 gram per deciliter. The normal range for hemoglobin levels in an adult male is 13.6 to 17.7 gram per deciliter. Hemoglobin levels above that range may be indicative of chronic low blood oxygen, while lower levels of hemoglobin are seen in anemia. What should you expect to hear when percussing the seventh intercostal space along the right midclavicular line? A. Dullness. B. Hyperresonance. C. Tympani. D. Resonance. The answer is A. Dullness. When percussing the seventh intercostal space along the right midclavicular line, you should expect to hear a dull note, as this is directly over the solid mass of the liver. The border of the liver can be found by percussing in a descending line along the intercostal spaces of the right midclavicular line, starting at the clavicle. The superior border of the liver can be measured at the point where percussion transforms from resonant or hyperresonant, indicating the air-filled lung, to dull, indicating the solid mass of the liver. On palpating the abdominal aorta, the diameter of the aorta is measured at 3 cm. This indicates an abdominal aorta that is dash. A. Narrow door constricted. B. Normal size. C. Significantly enlarged and at risk for rupture. D. Slightly enlarged. The answer is B. Normal size. A healthy and normal abdominal aorta will measure between 2.5 to 3 cm in diameter. An abdominal aorta over 3 cm and under 5 cm in diameter is considered to be enlarged, and surgery to prevent abdominal aortic aneurysm is generally performed on abdominal aortas that surpass 5 cm in diameter in females or 5.5 cm in diameter in males. A patient reports to urgent care for colicky pain in the upper right quadrant that they rate as a 7 out of 10. The night before they ate a fatty meal with 2 glasses of wine. Which of the following tests would help you assess for cholecystitis? A. McBurney's point. B. Soa's sign. C. Murphy's sign. D. Rovsing's sign. The answer is A. Murphy's sign. A positive Murphy's sign is an indication of cholecystitis, or gallbladder inflammation. Testing for Murphy's sign is performed during an abdominal exam by asking the patient to breathe out slowly while the fingers of the examiner are slid under the right costal margin and held in place with firm pressure. The patient is then asked to inhale, which forces the abdominal contents upward. Murphy's sign is considered positive if the patient winces or flinches when breathing in, due to pain when the inflamed gallbladder comes in contact with the examiner's fingertips. Rovsing's sign, Soa's sign, and McBurney's point are all tests for appendicitis. When testing for the strength of the left biceps brachii muscle, a patient is found to be able to move freely against gravity, but is unable to flex against very gentle resistance by the examiner. What grade of muscle strength should their bicep be assigned? A. 3 of 5. B. 2 of 5. C. 4 of 5. D. 1 of 5. The answer is A. 3 of 5. In this case, the patient is able to move their biceps brachii against gravity, but they are unable to move against gentle resistance by the examiner. This means the muscle strength should be graded at 3 of 5. The muscle strength grade is as follows: 0 of 5, no contraction 1 of 5, muscle contraction, but no movement 2 of 5, movement with gravity, but not against gravity 3 of 5, movement against gravity, but not against resistance 4 of 5, movement against mild resistance by the examiner 5 of 5, normal muscle strength. What is the reference range for normal potassium levels? A. 3.5 to 5.0 milliequivalents per liter. B. 3.5 to 4.8 milliequivalents per liter. C. 3.2 to 5.0 milliequivalents per liter. D. 3.2 to 4.8 milliequivalents per liter. The answer is A. 3.5 to 5.0 milliequivalents per liter. The range for normal potassium levels in blood is 3.5 to 5.0 milliequivalents per liter. Anything above that, hyperkalemia, or below that range, hypokalemia, is considered abnormal. What is the reference range for normal sodium levels? A. 138 to 148 milliequivalents per liter. B. 130 to 140 milliequivalents per liter. C. 135 to 145 milliequivalents per liter. D. 132 to 142 milliequivalents per liter. The answer is C. 135 to 145 milliequivalents per liter. Normal levels for sodium are between 135 to 145 milliequivalents per liter. Anything below 135 milliequivalents per liter, hyponatremia, or above 145 milliequivalents per liter, hypernatremia, this is considered abnormal and should be evaluated further. Which of the following is the normal adult reference range for blood calcium levels? A. 9.5 to 11.0 milligrams per deciliter. B. 8.0 to 9.5 milligrams per deciliter. C. 9.0 to 10.5 milligrams per deciliter. D. 8.5 to 10.0 milligrams per deciliter. The answer is C. 9.0 to 10.5 mg per deciliter. The normal adult reference range for blood calcium levels is 9.0 to 10.5 mg per deciliter. What is the normal reference range for an adult male hematocrit? A. 40% to 50%. B. 42% to 52%. C. 45% to 55%. D. 47% to 57%. The answer is B. 42% to 52%. An adult male hematocrit is considered normal when between 42% to 52%. Anything below this may indicate anemia, elevated white blood cell count, or blood loss, while numbers above this may indicate dehydration, chronic oxygen deficiency, or a condition of excess red blood cell production, such as polycythemia vera. What is considered the normal reference range for an adult female hematocrit? A. 39% to 49%. B. 35% to 45%. C. 34% to 44%. D. 37% to 47%. The answer is D. 37% to 47%. The normal reference range for an adult female hematocrit is 37% to 47%. Anything below this may indicate anemia, elevated white blood cell count, or blood loss, while numbers above this may indicate dehydration, chronic oxygen deficiency, or a condition of excess red blood cell production, such as polycythemia vera. A 67-year-old male presents to your clinic with a blood pressure of 129/82 mm of mercury, temperature is 98.9 degrees Fahrenheit, and heart rate is 82 beats per minute. Blood work shows a cholesterol level of 162 mg per deciliter, fasting blood glucose of 98 mg per deciliter, and WBC count of 9,000 cells per microliters. His history is significant for street segment elevation myocardial infarction, STEMI, 7 years prior. What, if anything, would you counsel him regarding his vitals and blood work? A. His cholesterol is too high. B. His heart rate is elevated. C. Fasting blood glucose is too high. D. WBC count is elevated. The answer is A. His cholesterol is too high. All of his vitals and blood work are within normal range except his cholesterol. Normally, cholesterol is considered within normal range if it is under 200 mg per deciliter, but in the case of patients with past history of cardiac event or stroke, cholesterol should be maintained at under 150 mg per deciliter. Which of the following is considered the normal range for platelet count on a complete blood count, CBC? A. 100,000 to 400,000 cells per microliter. B. 200,000 to 500,000 cells per microliter. C. 150,000 to 400,000 cells per microliter. D. 150,000 to 450,000 cell. The answer is C. 150,000 to 400,000 cells per microliter. The normal range for a platelet count on a CBC is 150,000 to 400,000 cells per microliter. Numbers below 150,000 cells per microliter may result in poor clotting ability, while numbers above 400,000 per microliter may increase risk of stroke or thrombosis. Which of the following values would be considered a normal erythrocyte sedimentation rate, ESR? A. 18 mm per hour. B. 34 mm per hour. C. 72 mm per hour. D. 45 mm per hour. The answer is A. 18 mm per hour. A normal erythrocyte sedimentation rate should be below 20 mm per hour. Anything above this indicates some sort of inflammatory process. Which of the following is considered the normal range for specific gravity on urinalysis? A. 1.015 to 1.035. B. 1.010 to 1.030. C. 1.001 to 1.020. D. 1.005 to 1.025. The answer is D. 1.005 to 1.025. While adults may have a specific gravity that ranges anywhere from 1.000 to 1.030, the normal reference range is generally considered to be 1.005 to 1.025. A specific gravity below 1.005 could indicate very dilute urine. The specific gravity of water is 1.000, and anything higher than 1.030 may be present in the case of dehydration, kidney disease, infection, or glucose in the urine. Blood pH is maintained by the body in a very close range. What is the normal range for pH of the blood? A. 7.35 to 7.45. B. 7.37 to 4.47. C. 7.32 to 7.42. D. 7.34 to 7.44. The answer is A. 7.35 to 7.45. The normal range for pH of blood is 7.35 to 7.45. Anything below that range is considered to be acidosis, while values above that range would be considered alkalosis. Recall that the main blood buffer system involves carbonic acid, bicarbonate, and carbon dioxide. Which of the following is not determined by urinalysis? A. Specific gravity. B. Presence of blood. C. pH. D. Presence of bacteria. E. All of these are determined by urinalysis. The answer is E. All of these are determined by urinalysis. A urinalysis can be an important tool in diagnosis conditions such as the presence of kidney stones, urinary tract infection, and even dehydration. A typical urinalysis will contain information on all of the parameters indicated. The presence of glucose, ketones, crystals, casts, and leukocyte esterase may also be included. Washed red blood cells are generally administered to which of the following patient populations? A. Patients with metastatic disease. B. Patients who are immunocompromised. C. Patients with a history of allergic reactions to transfusions. D. Patients with chronic kidney disease. The answer is C. Patients with a history of allergic reactions to transfusions. Washed red blood cells are generally prepared for patients with a history of severe allergic reaction to blood transfusion. Washed red blood cells are not generally required in patients with kidney disease, patients who are immunocompromised, or patients with metastatic disease. Before administration, all plasma products must be tested for which of the following? A. ABO compatibility. B. RH compatibility and ABO compatibility. C. RH compatibility. D. None of these are correct. The answer is B. RH compatibility and ABO compatibility. Before administration, plasma products must be checked for ABO compatibility and RH compatibility. ABO blood type does not have to be an exact match, but blood types must be compatible. An RH positive individual, for example, is compatible with either RH negative blood or positive blood, while an RH negative individual is only compatible with RH negative blood. A nurse is performing standard cardiac auscultation on a 47-year-old male with normal heart size. Where would the nurse listen to evaluate the pulmonic valve? A. The second left intercostal space. B. The first left intercostal space. C. The first right intercostal space. D. The second right intercostal space. The answer is A. The second left intercostal space. The pulmonic valve can be auscultated to the left of the sternum at the second intercostal space. Auscultation at this space can aid in the identification of pulmonary murmurs such as pulmonary stenosis or regurgitation. The second right intercostal space is the location at which the nurse would be able to evaluate the aortic valve. The first intercostal space is not generally auscultated in a normal heart exam. A nurse is performing standard cardiac auscultation on a 47-year-old male with normal heart size. The nurse pauses to listen at the fifth intercostal space on the left midclavicular line. The nurse is evaluating which of the following? A. The mitral valve. B. The pulmonic valve. C. The tricuspid valve. D. The aortic valve. The answer is A. The mitral valve. The fifth intercostal space on the left midclavicular line is the best location from which to evaluate the mitral valve. The other heart structures are paired with locations as follows. Aortic valve, the second intercostal space right of the sternum. Pulmonic valve, the second intercostal space left of the sternum. Tricuspid valve, the fourth intercostal space left of the sternum. A nurse administers 1 unit of packed red blood cells. 4 to 6 hours later, what change can be expected in the patient's hemoglobin levels? A. 5% decrease. B. 3% increase. C. 20% increase. D. 15% increase. The answer is B. 3% increase. A nurse should expect to see an approximately 3% increase in the recipient's hemoglobin 4 to 6 hours after the administration of 1 unit of packed red blood cells. Which of the following has been removed from washed red blood cells? A. Plasma. B. Antibodies. C. Platelets. D. All of these are correct. The answer is D. All of these are correct. Washed red blood cells are the product of blood that has been stripped of plasma, leukocytes, antibodies, cytokines, and platelets, in addition to any other blood proteins. After thawing, Fresh frozen plasma must be used within which of the following time frames? A. Within 12 hours, if refrigerated. B. Within 24 hours, if refrigerated. C. Within 30 minutes, refrigeration is not advised. D. Within 2 hours, if refrigerated. The answer is B. Within 24 hours, if refrigerated. Whenever possible, fresh frozen plasma should be transfused immediately, or as soon as possible, after thawing. However, if this is not possible, it may be refrigerated for as long as 24 hours after thawing. Which of the following laboratory values is not reported in a basic metabolic profile, BMP? A. Sodium. B. Blood urea nitrogen, BUN. C. Phosphorus. D. Creatinine. E. Potassium. The answer is C. Phosphorus. A BMP is a commonly ordered lab value set on patients. It checks commonly reported electrolytes in the body. It is also known as a Chem7. It looks at sodium, potassium, carbon dioxide, bicarbonate, blood urea nitrogen, BUN, creatinine, and glucose. Phosphorus is not included in this laboratory order, and must be checked separately. A nurse is reviewing labs for a 68-year-old female. Lipid testing revealed a total cholesterol of 230 mg per deciliter. This patient's cholesterol level would be defined as dash. A. Normal. B. Low risk. C. Moderate risk. D. High risk. The answer is C. Moderate risk. A total cholesterol over 200 mg per deciliter is considered a risk factor for cardiovascular disease. A total cholesterol level of 200 to 240 mg per deciliter is considered moderate risk, while a total cholesterol of over 240 mg per deciliter is considered a high risk for cardiovascular disease. This patient's total cholesterol is 230 mg per deciliter, which would place her in the moderate risk category. Which of the following might be a sign of a transfusion reaction? A. Pallor or cyanosis. B. Urticaria, itching, or swelling. C. Myalgia, tingling, or numbness. D. All of these are correct. The answer is D. All of these are correct. Common signs of transfusion reaction include urticaria, itching, or swelling, pallor or cyanosis, anxiety, and myalgia, tingling, or numbness, in addition to diaphoresis, tachycardia, headache, and gastrointestinal distress. Droplet precautions are designed to stop the spread of infectious diseases that travel through droplets. These droplets may land on the mucosa of the nose or mouth after a host sneezes or coughs. Which of the following conditions does not require the use of droplet precautions? A. Influenza. B. Varicella. C. Rubella. D. Mumps. E. Pertussis. The answer is B. Varicella. Varicella requires airborne precautions. Staff caring for patients with varicella should be immune. One's immunity to varicella can be confirmed by a blood test. Standard precautions are a set of guidelines that are designed to prevent the spread of infection by exposure to an individual or their bodily fluids. Which of the following is not considered a standard precaution? A. The use of alcohol-based gel after patient contact. B. The use of gloves when placing a peripheral intravenous line. C. The availability of appropriate and cleanly resuscitation equipment. D. Placing clients in private rooms. E. Disposal of used linens in designated areas. The answer is D. Placing clients in private rooms. Standard precautions should be utilized in the care of every patient. Hand hygiene before and after patient contact is always required. Clean, functioning equipment should always be available. The use of personal protective gear when there is potential to blood or bodily fluid exposure is critical. This includes the proper disposal of soiled materials such as linens. However, it is not necessary for patients to be housed in private rooms unless they are affected by an infectious disease. If private rooms for infectious individuals are unavailable, it is acceptable to place patients in cohorts of the same infectious disease. The nurse is caring for a patient with severe agoraphobia. What area of the hospital should the nurse avoid with the patient? A. Areas with lots of people. B. Areas with lots of needles. C. Enclosed areas. D. Wide open spaces. The answer is D. Wide open spaces. A patient with agoraphobia has a fear of wide open spaces. A 4-year-old child is admitted to the hospital after his family was in a car crash, where his parents died. The child keeps asking you to bring his parents back to life. The nurse knows that. A. The child is delusional and may have suffered a concussion as a result of the crash. B. The child has not seen a person die before. C. The child is depressed. D. This is a normal reaction. The answer is D. This is a normal reaction. This is a normal reaction for a young child, who may not fully understand death. These requests are not necessarily indicative of delusion or depression. When reviewing a client's chart, the nurse sees that the doctor identified that the client is experiencing a situational crisis. An event that could cause this is A. Retirement. B. Child abuse. C. Rape. D. Abortion. The answer is D. Abortion. Abortion is a common cause of a situational crisis. Retirement may cause a maturation crisis, and child abuse and rape may cause an adventitious crisis. The nurse is caring for a patient with severe agoraphobia. What area of the hospital should the nurse avoid with the patient? A. Areas with lots of needles. B. Areas with exposed levels, such as balconies. C. Wide open spaces. D. Enclosed areas. The answer is B. Areas with exposed levels, such as balconies. A patient with agoraphobia has a fear of heights, thus exposure to exposed levels or other significant drop-offs will scare the patient. A patient is seeking an herbal solution that produces an effect similar to estrogen. What herb should the nurse suggest the patient investigate? A. Cat's claw. B. Black cohosh. C. Feverfew. D. Milk thistle. The answer is B. Black cohosh. Black cohosh produces effects similar to those of estrogen. The patient is curious about behavior therapy, and asks the nurse. The nurse would best describe behavior therapy as A. A therapy that makes use of physical and social environments. B. A therapy that makes use of a group dynamic. C. A therapy that achieves results through conditioning. D. A therapy that makes use of relationships and personal connection. The answer is C. A therapy that achieves results through conditioning. Behavior therapy is a therapy that achieves results through conditioning. The therapy aims to reinforce desired behaviors and eliminate undesired behaviors. A patient is seeking an herbal solution that improves microcirculation in the eyes. What herb should the nurse suggest the patient investigate? A. DHEA. B. Peppermint oil. C. Bilberry. D. Aloe. The answer is C. Bilberry. Bilberry improves microcirculation in the eyes. Which of the following herbs aids in wound healing when applied topically? A. Red raspberry leaf, Robustiaeus. B. Hawthorn berry, Crocus ssp. C. Yellow dock, Rumex crispus. D. Calendula flower, Calendula officinalis. The answer is D. Calendula flower, Calendula officinalis. Calendula flower contains fardiola and the fardiol monaster, powerful anti-inflammatory and anti-edematous tritopanoids, which have shown effects comparable to indomethacin. Yellow dock is as a laxative. Red raspberry leaf is a vasodilator, and may exacerbate inflammation. Hawthorn berry can be used to ameliorate symptoms of congestive heart failure. Which of the following herbs contains a compound similar to lovastatin? A. Nettle, Urticularia. B. Kava, Piper methisticum. C. Red yeast rice, Meniscus purpureus. D. Lavender, Lavandula. The answer is C. Red yeast rice, Meniscus purpureus. Red yeast rice contains monocolins, which block the production of cholesterol. Monocolin K has the same structure as lovastatin and functions similarly to reduce cholesterol. Nettle is best used as a painkiller, and to treat disorders of the excretory system. Kava is a sedative and anesthetic, and may also be used to treat social anxiety. Lavender has a calming effect, and is effective in inducing sleep. Which is the most common homeopathic remedy for mild otitis media in a child that is weepy, clingy, and refuses fluids? A. Belladonna. B. Pulsatilla. C. Sepia. D. Arsenicum album. The answer is B. Pulsatilla. Pulsatilla is most often given for otitis media when the child is clingy, weepy, refuses fluids, and wants to be held or carried. They may be hot or sensitive to heat and desire fresh air. Belladonna may be used as a pain reliever, and an anti-inflammatory remedy. Arsenicum album is commonly used to treat anxiety and gastrointestinal inflammation. Sepia is most often used to treat female reproductive-related ailments. Which of the following hydrotherapy treatment might be most beneficial for a repetitive stress injury? A. Warming socks. B. Hot fermentation. C. Infrared sauna. D. Hot and cold contrast therapy. The answer is D. Hot and cold contrast therapy. Hot and cold contrast therapy consists of submerging the painful joint in hot water for 5-10 minutes, then submerging it in cold or icy water for 30 seconds, then back to hot for 3 cycles. This treatment reduces pain and inflammation and is common in sports medicine. Infrared saunas use radiation to heat the sauna, rather than typical saunas, which primarily use convection. Both are effective for pain relief and relaxation. Hot fermentation can be used to decrease swelling and provide relief from pain due to menstrual cramps. Warming socks are used as a hydrotherapy treatment to increase circulation and raise body temperature, which can help when fighting infection. Which of the following homeopathic remedy is indicated for acute urinary tract infection with intense dysuria and frank hematuria? A. Bryonia. B. Meterinum. C. Canthres. D. Calcarea carbonica. The answer is C. Canthres. Canthres is indicated in urinary tract infections with frequency, dysuria, and frank hematuria. Patients may also experience flank or back pain, restlessness, and anxiety. Bryonia is used for pains associated with cold and flu. Meterinum has been used to treat urethral discharge in male patients with gonorrhea. Calcarea carbonica can be used to treat physical fatigue and muscle atrophy due to malnutrition and/or infections such as mononucleosis. Which of the following homeopathic remedy is most commonly indicated for post-streptococcal glomerulonephritis? A. Natrum sulfuricum. B. Palladium. C. Apis. D. Berberin. The answer is C. Apis. Apis is the most common remedy given for post-streptococcal glomerulonephritis. The patient may be restless and heat intolerant. Other common symptoms are back pain worse in the area of the left kidney and pain or pressure on stooping. Berberin may be used for heart failure, skin burns, and some bacterial infections. Natrum sulfuricum is used to treat liver and gastrointestinal problems. Also, it may be used for headaches and asthma. Palladium may be used for headaches too. Which of the following herbs has hypnotic, sleep-inducing, properties? A. Licorice, Glycyrrhiza glabra. B. Chicory, Cicoria mindibus. C. Passion flower, Passiflora incarnata. D. Golden seal, Hydrastis canadensis. The answer is C. Passion flower, Passiflora incarnata. Passion flower has been studied widely for its uses as a sleep aid. It is also anxiolytic, and has been used to treat abdominal pain and GI upset, arrhythmia and hypertension, and topically for burns and hemorrhoids. Note, passion flower is not safe in pregnancy as it may stimulate uterine contractions. Chicory can be used for its toxicity to internal parasites, namely intestinal worms. Golden seal may be used as a remedy for the common cold and/or upper respiratory infections. Licorice may be used to treat inflammation of the gastrointestinal tract. Which of the following mind-body practice has been shown to increase both T cells and natural killer cells? A. Yoga. B. Meditation. C. Music therapy. D. All of these. The answer is D. All of these. All of these mind-body therapies have been shown to increase the activity of natural killer cells and cytotoxic T cells. Which is the most common homeopathic remedy for acute otitis media which starts suddenly, where the tympanic membrane is hot and bright red and the child is restless and anxious? A. Nitrium muriaticum. B. Belladonna. C. Pulsatilla. D. Sulfur. The answer is B. Belladonna. Belladonna is the most frequently given remedy when otitis media is sudden onset, bright red and hot, and the child is restless and may be confused, anxious, or frightened. Pulsatilla is used to treat reproductive pain in both men and women, and for migraines. Nitrium muriaticum is more effective as a remedy for chronic, not acute, disorders. Sulfur is most effectively used on the skin and eyes to treat irritation. Which is the most common homeopathic remedy for acute gastroenteritis, food poisoning? A. Graphites. B. Arsenicum album. C. Platinum. D. Belladonna. The answer is B. Arsenicum album. Arsenicum album is the most common remedy given for acute gastroenteritis with vomiting and diarrhea, especially when diarrhea and vomiting happen simultaneously. Diarrhea is in small amounts constantly throughout the day, and the affected person is experiencing chilliness and marked tenderness in the abdomen. Graphites are most commonly used to treat skin disorders. Platinum is used to treat a range of psychological and physiological aspects of women's health. Belladonna may be used as a pain reliever, and an anti-inflammatory remedy. Which of the following herb has been used effectively to decrease both Candida overgrowth, thrush, vaginitis, and dysbiosis, and Epstein-Barr virus infection? A. Milk thistle, Silybum marianum. B. Licorice, Glycyrrhiza glabra. C. Red yeast rice, Meniscus purpureus. D. Berberin, found in Oregon grape and golden seal. The answer is D. Berberin, found in Oregon grape and golden seal. Berberin has been used alone and in conjunction with fluconazole to successfully treat fluconazole-resistant Candida infections. It has also been shown to have an inhibitory effect on Epstein-Barr DNA replication. Red yeast rice may be used to lower cholesterol. Glycyrrhiza glabra can be used to decrease inflammation, and cough, and to promote ulcer healing. Milk thistle is used as a remedy for hepatic disorders. Which is the most common homeopathic remedy for any kind of blunt trauma followed by a state of dullness and shock? A. Pulsatilla. B. Nux vomica. C. Simisafuga. D. Arnica. The answer is D. Arnica. Arnica, a herbaceous plant, is the remedy most often used for states of shock after an injury, during which the injured person may refuse medical help due to fear of further injury. Pulsatilla is a plant that may be used for pain in the reproductive organs, restlessness, and other ailments. Nux vomica seeds may be used for gastrointestinal discomfort, anemia and erectile dysfunction. Simisafuga is a plant that may be used to alleviate neurological disorders. Which of the following herbs can block thyroid-stimulating hormone, TSH, receptors and decrease peripheral conversion of thyroxine, T4, to triiodothyronine, T3? A. Lycopus virginicus, bugleweed, and Melissa officinalis, lemon balm. B. Z-Maze, Nclex, and Sambucus nigra, elderberry. C. Berberis vulgaris, barberry, and Epimgraviolens, celery. D. Panax ginseng and Symphytum officinae, comfrey. The answer is A. Lycopus virginicus, bugleweed, and Melissa officinalis, lemon balm. Lycopus virginicus, bugleweed, and Melissa officinalis, lemon balm, have both been shown to inhibit conversion of T4 into T3 in the peripheral tissues, and have been used to treat mild cases of hyperthyroidism. The other herbs listed have no specific effect on peripheral thyroid hormone conversion. Berberis vulgaris is used to treat respiratory conditions, and infections such as the cold and flu. Epimgraviolens has been used to treat pain. Panax ginseng has been used as a stimulant, and to treat sexual dysfunction in men. Symphytum officinae has been used to treat gout, and disorders of the gastrointestinal tract. Z-Maze may help treatment of skin diseases. Sambucus nigra is best used to treat upper respiratory infections. Urticularia, stinging nettle, leaf is used for all of the following except dash. A. Anti-inflammation. B. Psoriasis. C. Nutritional support. D. Allergic rhinitis. The answer is B. Psoriasis. Urticularia, stinging nettle, leaf extract contains antagonists of the histamine 1, H1, receptor, thus decreasing symptoms of allergic rhinitis and sinusitis. Nettle leaf extract also contains factors that inhibit mast cell tryptase, preventing degranulation and release of a host of pro-inflammatory mediators that cause the symptoms of hay fevers, and inhibits cyclooxygenase 1, COX-1, cyclooxygenase 2, COX-2, and hematopoietic prostaglandin D2 synthase. As a nutritive, nettle leaf is an excellent source of vitamin A, vitamin C, iron, and calcium. Nettle leaf has shown no benefit in treatment of psoriasis, though it may help to correct any underlying nutritional deficits. Which botanical is known for its antiviral, antiretroviral activity? A. Crataegus spp, hawthorn. B. Avenus sativa, milky oat seeds. C. Melissa officinalis, lemon balm. D. Hypericum perforatum, St. John's wort. The answer is D. Hypericum perforatum, St. John's wort. Hypericum perforatum, St. John's wort, has shown significant antiviral activity against a wide variety of enveloped viruses and retroviruses. Melissa officinalis, lemon balm, and Avenus sativa, milky oat seeds, are both better known for their sedative effects, and Crataegus spp, hawthorn, is used as an antiarrhythmic and mitigates oxidative stress in cardiomyopathies. What antimicrobial constituent makes Artistophilus uva ursi useful for treating urinary tract infections? A. Tannins. B. Hydroquinone glycosides. C. Flavonoids. D. None of these. This herb is not used for urinary tract infections. The answer is B. Hydroquinone glycosides. Uva ursi contains the hydroquinone glycosides arbutin and methylarbutin, both of which have shown significant antimicrobial effects in the urinary tract. The other constituents listed have no effect on urinary infections. Which of the following homeopathic remedy is indicated for irritable, colicky infants who cry frequently and arch their back and who are only soothed by bouncing or pressure, such as swaddling? A. Arsenicum album. B. Arnica. C. Chamomilla. D. Calcarea carbonica. The answer is C. Chamomilla. Children needing chamomilla are hot, irritable, and very sensitive to pain. Infants are prone to colic and gastroesophageal reflux disease, GERD. They will often arch backwards when crying, and will be soothed when bounced, carried, patted, or swaddled. These infants experience difficult dentition and will chew their fingers before teething. Arsenicum album and Calcarea carbonica are both more often indicated for chilly babies that are prone to anxiety, while arnica is generally given for people who have experienced some sort of dissociative shock from a physical or emotional trauma. What are 3 good food sources of copper? A. Sesame seeds, cashews, green leafy vegetables. B. Grapefruit, pear, bean sprouts. C. Beef, eggs, apples. D. Tomatoes, bananas, rice. The answer is A. Sesame seeds, cashews, green leafy vegetables. Sesame seeds, cashews, and green leafy vegetables have among the highest levels of copper per serving. Other foods high in copper include crimini mushrooms, organ meats, shellfish, and beans. All of the other foods listed are low copper foods, often recommended for patients with disorders of copper metabolism, such as Wilson's disease. By what age should an infant be able to pull itself up to standing? A. 6 months. B. 12 months. C. 9 months. D. 18 months. The answer is C. 9 months. An infant should have the ability to pull itself up to standing by the age of 9 months. If standing is not seen after 12 months, the child should be evaluated for any type of physical developmental disabilities or delays. At what age can an infant begin eating solid foods? A. 4 months. B. 3 months. C. 9 months. D. 6 months. The answer is D. 6 months. Solid foods should not be introduced into an infant's diet before 6 months of age. Earlier introduction may trigger specific food allergies, as well as reducing breast milk production in a breastfeeding mother. An audible click when the examiner slips the femoral head forward is considered positive for what sign? A. Scarf sign. B. Babinski sign. C. Ortolani sign. D. Brudzinski sign. The answer is C. Ortolani sign. An audible click when the examiner slips the femoral head forward is considered a positive Ortolani sign. This finding suggests congenital hip dysplasia. Babinski sign is the presence of the Babinski reflex, which is normal in infants. Scarf sign is used to assess developmental age and muscle tone in neonates. Brudzinski sign is not related to the musculoskeletal system but is part of a physical examination in cases of suspected meningitis. At what age does the posterior fontanelle close? A. 4 weeks. B. 12 weeks. C. 16 weeks. D. 8 weeks. The answer is D. 8 weeks. The posterior fontanelle, which is the cartilaginous gap at the junction of the lambdoid suture and the sagittal suture, closes at 8 weeks of age. The answer is D. 8 weeks.